My name is Maggie McKinstry and I'm one of the community nurses from the Community Learning Disability Service.
I'm Neil Douglas. I'm a GP at Island Health Surgery on the Isle of Dogs. I've been working here for 17 years as a GP and have a particular interest in people with learning disabilities.
My name is Angela Paul and I'm a community nurse.
I'm Stevie Newman. I'm a senior specialist speech therapist with the learning disability team here in Tower Hamlets.
Do you find the doctors talk to you yourself, or do they talk to your parents or your
Sometimes
family?
they talk to me and sometimes they talk to my mum.
How does that make you feel if they talk to your mum?
Angry.
Why?
Because they should talk to me. I'm the one seeing them.
The GP should, where possible, speak to the client initially, and if it's clear that that hasn't been understood, then perhaps with the permission of the client or patient, ask the carer to translate, and perhaps in a language that the carer knows that the service user uses. But primarily there must be that interface between the GP and the patient.
What doctors need to know when they're working with patients with learning disability is that you need time in a consultation, that you need to be aware of your communication skills, and to take things probably a little bit slowly in terms of your verbal communication, and take time as well with the patient to listen to their concerns.
Because when I go there, sometimes it makes me angry, then I walk out again. Then I think, no, I should go back in again. You know what I mean? I get confused sometimes.
I deal with people with learning disabilities every day, and my job is to look at the communication. I tend to work with people who don't have any communication at all, so they're what we call pre-verbal or non-verbal communicators. But it's widely accepted in my field of practice that everybody does have some means of communication, even if it's somebody who has what we call challenging behaviour. Someone who can't say, I'm in pain, may behave very badly, may challenge, and they may be throwing things, they may be crying, they may be screaming, but that in itself is a way of communicating, and that's something that I look at when I'm assessing a client who isn't able to speak.
One of the other things was that sometimes you couldn't get your doctor to come out on a home visit. Sometimes the doctor didn't give a good explanation, and sometimes the appointment was just too quick.
All the various augmentative systems give the client an ability to make choices and to make their needs known in varying degrees. It's objects of reference obviously we use with the clients who are less able to communicate, and then we can go on to using techniques such as pictures, symbols, Makaton signing. Makaton signing is a signing system that's based on British Sign Language, but actually uses keywords, the keyword elements within the sentence to keep the sentence simple, so that the client has a better understanding. Given that many clients with a learning disability have other sensory deficits, there may be visual problems. Quite a significant number of our service users have hearing problems in varying degrees. It would isolate the client, it would marginalise the client if he or she weren't able to have some sort of system of communicating their needs.